All kinds of cancer, including childhood cancer, have a common disease process. Cells grow out of control, develop abnormal sizes and shapes, ignore their typical boundaries inside the body, destroy their neighbor cells, and ultimately can spread to other organs and tissues. Cancer tries to take the joy of childhood away, but with new medical advancements being made every year, the survival rates are much higher than ever. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We begin our discussion on childhood cancers with Dr. Jamie Libes-Bander, who specializes in pediatric hematology and oncology at Arnold Palmer Hospital Haley Center for Children's Cancer and Blood Disorders. Now, her philosophy is to treat every patient and their family with empathy and respect. She involves patients in decision-making and treatment planning as much as possible. Thank you for being with us.
Oh, thank you.
So that was important for us to say, that you involve the families.
Sure.
And with pediatric cancer, which is a topic that none of us wish we had to talk about, you have to talk about that sometimes with the patients themselves. How do you do that with a young one?
We get a lot of help from our child life therapist using play therapy, different models. If we have to explain the blood cells, we may have actually models to explain what they look like. And really just kind of using simple terms, comparing it to things that they may be familiar with, but very basic.
Kind of help them
terms.
through the process.
Yeah, and it really depends on the ages. You know, our older patients who understand more, we can compare to something they've learned in science classes.
What's the most difficult part of your job?
When patients don't do well.
Yeah.
You know, we have a really good survival rate. 80 to 85% of our patients will become long-term survivors. But for the kids that don't survive, that's really tough.
Are you seeing trends that give you hope? Are you seeing numbers go up, down, stay steady? Where are we on that?
Our survival rates have gone way up. You know, they used to be around 20% or so, and for some diseases, they're over 90-95% now. So we're making a lot of progress. We just have some diseases where we need a lot more work.
You know, I don't think we often think about it, but do you have to treat childhood cancer differently than you do cancer in an adult?
They're very different diseases. We use some of the same chemotherapies, you know, and just like the adults use radiation therapy and now some immunotherapies, we have some of that also. But I think just thinking about it in a different philosophy is kind of how childhood cancer is different, where the child can't make a decision for themselves. Mm-hmm. So an adult oncologist may be able to offer families and the patients 2 or 3 different treatment options and let the patient choose for himself. The child can't really do that, and so we often are discussing it with the child, but also with the family and letting the parents decide. We have a standard first-line therapy that we use, just like the adults would.
Now, what does that mean, first line?
Basically, if you have leukemia, we have a very good therapy outlined for you.
Okay.
If you relapse, you know, there may be a couple other options, and the oncologist will make a recommendation to the parents, and the parents can choose to follow that. Sometimes they look for different options.
How do you feel about that when you see families who say, yeah, we hear what you're saying, but we want to go another route? How does that impact you as a physician?
I think it depends where they are in therapy. You know, if somebody is not responding to chemo, we can offer 3, 4, 5 different options, and if the kid continues to progress, we can continue to offer chemo. Mm-hmm. But if it's causing more suffering than it is good, I think the parents have every right to say, no, I'm done. You know, when it's first first-line treatment of a very curable disease, and families say, no, I want to give something alternative, I don't want chemotherapy, and we know the child is not going to respond and likely will die from that, whereas they have a 90 and 95% chance of surviving with chemotherapy, it's very difficult.
So it sounds like a lot of your work is dealing with the emotional roller coasters that come with a child who's been diagnosed. How do they train you for that? Or can you get trained for that? We know med school, you've got a curriculum to make sure that you practice medicine, but are you trained for the psychological impact of it?
Not really. So we do psychology classes. We learn what children are able to absorb at different stages in their development, but a lot of it is kind of on the job, watching our mentors as we go through fellowship explain things, and as we watch our different mentors, we learn what styles we would prefer for ourselves. And a lot of it is judging the families. You know, some families are wanting more of the facts, you know, and they'll say, just tell me straightforward, what are the numbers, what do I need to do? And other families are more emotional at the time you're talking and will only absorb a little bit at a time, and so we take those conversations slower. It really depends on the family.
Well, what gives you hope about where treatment and research is currently with pediatric cancer?
I think now there's just so much being done as far as new therapies coming out. We see something that may be successful in the adult world, and if a child has the same mutation in their tumor, that those therapies may work for the child's tumor also. We just have access to more therapies now, and we're really just making so much progress, but again, lots more progress needs to be made also.
Now, we know you can't get into, you know, confidentiality issues, but if you were talking to someone now who got the unfortunate news that their child had cancer, what would be the top 3 things you would tell them to do or not do?
Not Google, to start with.
Okay.
We always start with that. There's just so much misinformation out there that we really give them some accurate websites to go to, and if they want to do additional reading, you know, places where they can find accurate information. To discuss any questions and concerns they have with the medical team. We have a huge team of doctors, nurses, child life therapists, social workers, just so many people there to help. You know, and we encourage families to really discuss any questions they have with the team and make sure they're comfortable with the plan. And really just to continue being mom and dad. We have a lot of families that kind of want to step in and lead the medical treatment, you know, and as much as we want to involve parents every step of the way that we can and make sure that they're comfortable and understand what they're doing, their most important job is still comforting the child, being mom and dad, making sure the child is eating and playing at home and living their best life, really, as much as they're able to.
With as much normalcy as they possibly can.
Exactly, exactly.
Well, thank you for the work that you do. It can't be easy, but I'm sure it's exciting for you to see all the new things on the horizon, and then to be able to put them in place has to be very gratifying.
Absolutely, and when the kids come back for our off therapy visits and we see them when they're back in school and their hair is regrown, it's just so rewarding.
Well, thank you for being a part of that fight.
Oh, absolutely.
We'll be back right after this. Diagnosis of childhood cancer is never easy to hear and can be even more difficult to navigate. But with taking care of the entire family, listening to caring doctors, and knowing we're on the cutting edge of stemming the tide, you can continue to have healthy connections. I'm Annetta Wilson. Thanks for joining us.